So I welcome you all today as the IDI partners with Uganda Youth and Adolescents Health Forum to take us through this very crucial matter in our respective areas of residence.
Singa nsobola okwogera n'oyo, are we a safe space for them?
And the mother was saying, when this man comes to me, I'm also finished. He's going to send me away. Because she wanted this girl to get married, she gets the girls.
When you get information provided on the medical form, will it be sufficient to guide your investigations?
Give it to the SOCO. The SOCO marks it as an exhibit.
We have been in a training by UF about every hour matters. During the training, I've learned a lot of things, but what has taken me most is are the reporting channels, then the do's and don'ts to do with the survivors, or in case someone comes as a victim of sexual gender-based violence.
Training has been fruitful and the participants have really gained a lot because some of us have lacked the knowledge about how to handle the SGBV survivors, and many of the participants were having different perspectives about how to handle SGBV cases, and we have really gained a lot and understood how the thing should be done, where we have to report after coming across these cases.
Twasomye like don'ts need do's zorina okolanga in case they have reported that situation to you. Toina mwewala waba bigambye. Don't judge her in case nga kugambye situation. Scenarios zibadde mubiri. Emu ng'ekwatako Elizabeth, endala ng'ekwata Sarah ne Maureen.
I enjoyed the toolkit. The skits that were there were very educative because they exposed us to the do's and don'ts dealing with sexual gender-based violence.
Olwaleero kyenjize, in fact kyembadde simanyi nnyo nti waliyo hope omuntu nga kati katugambe omwana omuwala ng'akoleddwako obuliisamaanyi oba gye tuyita rape. Nti buli tweraliikirira nti gasevudutto gasobola okukwata omwana oyo n'afuna obulwadde tewaliiwo kiriwo. Naye olwaleero tukizudde nti singa tuba twanguyidde omwana omuwala oyo mu ssaawa 72 asobola okuziyizibwa olubuto lwatetegekedde, asobola okuziyizibwa kawuka akamukenenya n'abantu ajja kukosebwa, ate n'abudaabudibwa nadda mu mbeera eya bulijjo.
Of course tubadde ne safe space, naye safe space eyinadde ebulago. Kati twemanya safe space ey'omwana ono wajja kumuhandolinze etya sobola omanya ekizibu kye ne tukisolovinga then newe tubasindika.
I've actually learned a lot of things. We have learned about sexual gender-based violence, how to handle the girls, not being judgmental. You know, sometimes someone comes, you know, they open up their issues, but you do not know even how to help them. So I've learned how to go by their cases, help them, and also sensitize more about it.
The Dreams girls or the adolescent girls and young women receive curriculum sessions. For example, the stepping stones where the no means no. In those sessions, we talk about the GBV. So we shall make sure that we bring out this concept of every hour matters to the Dreams girls and make sure that they get this knowledge.
A lot I have learned, including things that we have been going through. We have reminded ourselves again today, especially about the gender-based violence and the girl child, what they go through, how to help them when they are in such challenges.
And I'm going also to tell it to the other Dreams peers or champions, people we are working with, that the first thing before you go to other things, you have to go to the health facilities to seek medication. Then another thing is when you see that you cannot support, at least you go talk to someone who can offer that help. Don't go alone. Don't handle the situation alone. There are other people who can give you a helping hand in handling those issues.
Kati atenze kinyambye nnyo nga ssentebe ow'ekyalo kubanga oluusi obadde ofuna okwebuuzibwa okutali okw'engeri ezitali zimu ate nga bwe tubeera n'enkiiko zaffe ez'ebyalo buli kiseera buli mwekomero ya mwezi noligenda okufuuka eddoboozi lya buli lukiiko lwe tuba tutuuzizza mbabuulire nti singa kino kiba kiguddewo mukole bwe muti kulw'amagezi genfunye wano olwaleero.
Basing on what I have learned today, it is true, not all of us are well versed or even aware of some of these cases and how to handle. Now that at least I have got an opportunity to learn, I will start with my station. I will talk to the staff I have and make them know how to handle these other cases that come in relationship with the sexual, gender-based violence.
I'm not going to keep this information to myself. I commit to also teach my fellow colleagues about this. Girls will open up, people will learn to speak up. Actually, I've also learned to speak up. So these kids are going to be able to speak up where necessary.
Creating awareness among those young girls. Abana abo to okubeera ng'oli friends basobole opening up kuba bangi balina bye basirikidde.
I will first make sure that I teach my fellow health workers through CMEs about the every hour matters so that we ensure services are offered in time. I will also mobilize the VSTs we work with at the facility and I equip them with the information so that they can transfer it to the families in their villages so that we can prevent delays during management of SGBVs.